Hello and welcome to the Society with Fatma Shaheen at PTV World. Considering that Pakistan turns 76 years this year, it's very important then to sit back and analyze how particularly has Pakistan, more specifically speaking, Pakistani society evolved over a period of time. And this is exactly what we'll be doing during the course of today's conversation. We'll be talking about the most notable, rather positive social developments which have happened in the Pakistani society since Pakistan came into being. Having said that, we'll be talking about over a period of time how particularly has not only Pakistan's education system but also the healthcare system evolved. In this regard, we'll also be talking about how we see, different quarters of the Pakistani society being empowered, be it women, be it children, be it young people, or for that matter, even minorities, the trans community, or people with different abilities. Moving on, we'll also be delving upon, of course, the evolution of Pakistani media, how that has evolved over a period of time, and how that in turn has actually empowered people too. And of course, last but not the least, we'll also be talking about the challenges which various sectors, various kinds of people in the country are today faced with, and what then again, of course, is the way forward. All of this today, that too with a very diverse panel. Let me introduce you to my today's panel. My first panelist for the show today is Miss Amna Tahir, who's an educationist. Assalamu alaikum ji and welcome to the show.
Walaikum assalam. Thank you, Fatma.
You're most welcome. Alongside her, I have Miss Yameen Hassan, who's a youth activist. Assalamu alaikum ji and welcome to the show.
Thank you.
You're most welcome. And my third panelist for the show today is Dr. Naeem Majid Saab, who's a healthcare expert. He's also the technical focal person for immunization in Punjab. Assalamu alaikum, sir, and welcome to the show.
Walaikum assalam and pleasure to be here.
You're most welcome. I would like to start the show with you and with this very famous quotation of Quaid-e-Azam Muhammad Ali Jinnah, which is, with faith, discipline and selfless devotion to duty, there is nothing worthwhile that one cannot achieve. Now, when we do talk about this very important, of course, quotation, how do you see it being applied to the young people of today? Because if you were to make an analysis, this is something which would very aptly apply perhaps to the elderly generation. But what about the younger people who come with their own ideas, who come with their own norms, with their own perceptions of life too?
Thank you, Fatma. So as Pakistan gets to see the sunrise of its 76th year, I feel a lot has radically changed ever since its inception. And I won't be wrong if I say, although there are many challenges that lies ahead of us and we are currently also being faced with, however, the youth of today has far more awareness and avenues to progress, and also the provision of resources that are handy for us. So our generation saw a different Pakistan, and I believe we are getting to see a different Pakistan altogether.
Right.
Yes.
On which I'll come to you, Ms. Yameen. Here we must take your youth narrative, which is something coming from the horse's mouth then. When we talk about young people in the country, how do you see their evolution? Because at least, if you look at it from an objective viewpoint, the positives are that people are generally more aware now, thanks to social media. They are more socially motivated. They take greater interest in politics. So what are the positives, in your opinion, of youth development over a period of time?
I think first of all, it's the awareness that they've gotten from the advancement of technology, and all that awareness has sort of, strengthened them both physically and psychologically. Now they're more aware of their rights and duties, and they're also keen to make a change. That is one of the major difference that we see when we compare our generation to the previous generation. Obviously, they did not have that exposure that we have now, and they also did not have that kind of motivation because they did not really have to face the issues that we face today. Like you see climate change, you see all the political issues, all these human rights issues that have emerged in the 21st century. They were largely unaware of that. So I think all of that, the generation today is largely different from the previous generation, and I think that is one of the major difference in terms of exposure, in terms of access to technology, in terms of access to the outside world as a whole, that makes them different.
So the exposure is definitely something which has increased thanks to usage of internet, technology and social media. But then again, this takes us to another very important and pivotal question, which then is that exposure being constructively used? On which I'll take you on board. So here we must also take your narrative too. When we talk about Pakistan's healthcare system, I think one positive which has genuinely emerged, and something which you mean very rightly so mentioned, is young people, even people generally, they are more aware about their health issues. How do you feel has that in turn impacted the healthcare system at large?
Yeah, so definitely since the awareness has been increasing over the past many years, and since the social media is now there, so people are getting different sorts of information. Sometimes it is medically correct, sometimes it is not correct. So they generally, move towards the hospitals or health facilities or healthcare providers to verify that information, and also to learn about what the preventive things are. Like, people are now more conscious about how they can prevent themselves from diabetes, from heart diseases, and even from the communicable diseases. So there is a more demand for vaccinations as well. Previously, we had seen that people would just ask for a vaccination certificate to travel, or for admission in some foreign medical.
So basically, now what you mean to say in essence is that the focus is on treating the disease as it may so occur. But when we talk about, sir, the concept of health, do you not feel then that now people also over a period of time take mental health more seriously, and this is something perhaps which we didn't see in the past few decades?
Yes, definitely, and not just the people. The government is also, taking mental health quite seriously now. For example, in Punjab, we previously had this mental hospital, but now they have upgraded it to call it as an institute of mental health.
Right.
Similarly, we are introducing mental health related trainings for our primary care staff, like lady health workers at the community level. So they are now talking about the mental stress associated with pregnancy and other things as well.
Right. So, in addition to that, then I think it's also very important that we talk about the fact the government in a first has also introduced this mental health app, using which now people can actually very readily, access mental health care professionals. And this is something which is very positive, because a lot of times we've seen in the past that there is a lot of stigma around mental health issues, so to speak. But coming towards you, Ms. Amna, here we must also talk about education. Now, we understand that the education system over a period of time has drastically evolved, be it in terms of the curriculum advancement, be it in terms of the way things are taught, or for that matter, even the ideal student-teacher relationship. So, how do you see changing over a period of time, either for the better or for the worse?
Well, we are committed in thriving for quality standard in education, and in order to meet high quality global standard as well. Education, it's true, has evolved over the past many years, and as Mr. Jinnah said, and I quote, education is a matter of life and death for Pakistan. So from brick and mortar schools to flagship state-of-the-art campuses, from rote learning and memorization to aiming for student-centered classrooms where students are given more autonomy of their learning and the teacher acts as a facilitator, to trying to inculcate all digital tools in our classrooms, and for sustainable learning throughout. Education has evolved, although I feel there are still some kinks in the fossilized teaching practices.
That's very right, because now we see that teachers generally, they are generally more cognizant, and of course they are more aware in terms of their teaching methods too, so to speak. Artificial intelligence is also added to that, because generally we do see now even teachers resorting to using the same too.
That's true, Fatma, because we believe that a well-equipped teacher in terms of subject knowledge and resources will automatically bring about enhanced learning outcomes in a classroom. And we have completely equipped them with all sorts of digital tools and made them tech savvy enough, especially after the onset of COVID. So we have equipped them and familiarized them with all sorts of digital tools such as Google, such as Workplace, Microsoft 365, that they are trying to inculcate every day in their lesson plans, because we want a sustainable learning plan for our students.
You want it to be something which is workable for everybody at the end of the day.
Yes.
On which I'll come to you, Ms. Yamin. Here we must talk about the digital divide. Now, this is something which has existed, and I think this is something which has become more glaring and, of course, more of a concern post the COVID-19 pandemic. So, as somebody who has also had that benefit of teaching students other than your youth activism per se, tell us that how do you tackle with this? Because at one end, we do see the education system progressing, but at the other end, we also understand the fact that this progression does come with its own limits too, because anybody who can't possibly use technology, anybody who can't access technology would not be able to fully benefit the digitalized education system, so to speak. So how do we address concerns like these?
So Fatma, it's actually a very important matter, and I think it has mostly to do with the training of the teachers. Like I talked about it in my previous answer, that people of the older generation are not that tech friendly and not that trained. So we grew up using technology and we sort of adapted it alongside. They grew up and they got exposure to technology after they reached a certain age, that that was way ahead of the age that.
Right, you mean. But moving on, here we must talk about the impact that youth activism has had in Pakistan. In this regard, we have seen young people have led not one, rather several movements, be it those relating to empowerment of women. And then internationally, we also see example of course, Greta Thunberg, who led this very important climate justice movement. So in Pakistan, when we do analyze youth activism, how do you see youth activism being translated into something which is concrete? How do you see it bringing about positive social change?
I think it's all about the changing of the mindset. So you see, there has been a massive transformation in people's mindsets towards, let it be women rights or let it be the inclusion of the people with disabilities. Like we see Malala Yousafzai, she's been representing Pakistan at the international level, and then we see Saima Salim, who despite being a person with disabilities, being blind, being visually impaired, represents Pakistan at the United Nations
That's
General
very
Assembly.
true.
And then we see a lot of female judges in Pakistan in Supreme Court. And recently there was a very positive development. There was a female judge that was appointed in the court of Gilgit-Baltistan as well.
That's
so
right.
I think it's a very positive picture for women of Pakistan, for the people of Pakistan, for the people with disabilities, that they are now being included in the policy making procedures, and they are being given
They are
representation.
part of the mainstream now,
Exactly,
basically. Although
and
it
that
has
is-
been a very slow and gradual process, you mean.
but
You
I
see,
think it's very applaudable being a third world country, and yet
Of
you see
course.
the status of people like these, like representing the country both at the national and international level. It's something to be very proud of.
That's right, you mean. On which I'll come to you, Doc Sab. Here we must also talk about the most notable, rather impactful initiatives which have been brought in by the government so as to improve both the quality and the standard of the healthcare provision. So, if you were to then evaluate, being the technical focal person for immunization in Punjab, what do you feel are the most important developments in this regard?
Yeah, so the health system has been evolving over the last many years, and a lot of improvement has been done. In that, I must say there has been an increase in the access to health services. For example, there is a rural ambulance service which picks up women at the time of delivery, brings them to the healthcare facility, and then if she needs a referral, they pick her from the primary care to the secondary hospital and even to the tertiary care if needed. Similarly, there are initiatives on improving the quality of healthcare services, which the Healthcare Commission regulates in all of the provinces, and it regulates both the public sector and the private sector. They have their own minimum service delivery standards which every hospital has to attain before they are licensed for practice. Similarly, the information systems are now, because there is a lot of technology available, so we are now moving towards getting real-time reports from even our primary healthcare facilities, from the outreach services. For example, if a child is vaccinated at his home, even the data is entered right at the doorstep and it is immediately sent into the central server, so we can know daily how much the performance of our workers is. So we
Right.
can improve their performance as well as look at the quality of service which they are.
That's right, Doc Saab. So, in that way, it's very important then to note the fact that all these developments have been happening for the better. But when we do talk about this one very pressing issue, which is that of the access or lack thereof of the healthcare system of the common man, how do you then justify that? Because a lot of times we see people who belong to perhaps the more rural areas, people who perhaps might be differently abled, or for that matter, those belonging to the trans community, they complain one way or the other, their access to the healthcare system is hampered. So, how do you justify that?
Yes, so for access to vulnerable groups, there are three main vulnerable groups when we talk about health. One is the women and children in rural areas. So for them, we have a very elaborate program, which is the Lady Health Workers program. So the Lady Health Workers go door to door. They refer them, they screen them, and then refer them to the health facilities. Then we have the ambulance service, which I mentioned earlier as well. Similarly, for the disabled people, there are the disabled-friendly health facilities. We are providing ramps and other things, wheelchairs, etc., at the health facilities, and also training and sensitizing our staff on how to deal with such people. Similarly, for transgenders, so a little less work has been done on the transgender side, but gradually we are sensitizing our staff, on how to handle them.
So that is something
Yeah.
definitely in the pipeline
Yeah.
you would want to add, basically. I think your narrative here becomes equally important too, from of the angle of educationists. When we talk about making education more inclusive, when we talk about making the education system more diverse and a better reflection of the different stratas of the Pakistani society, do you feel we've been able to do just that?
Well, Fatma, inclusivity is a very broad term, and under this umbrella of definition, not only does people with disabilities, and I think I would say people with special needs, they are not only parked under this umbrella, but all sorts of minorities, religious minorities,
Right.
trans community. So that is all parked under this umbrella of inclusivity. And as an educationist, I feel, well, there has been a sort of a ruffle in the feathers of the educational fabric, but I don't think we have sort of come to terms 10 on 10 with the idea that such people need to also be a part of the mainstream.
Although I do remember a few years back, we did have this one particular transgender school, but then again, that also invites the debate that is it not better to have the trans community in the mainstream school, so to speak? And when we talk about the differently abled persons, I have had that opportunity of interviewing several ones, and they still felt, even in terms of perhaps accessing the school building or going to the college or having the right assistive technologies, these are the things that we actually lack, and these are the things that we need to work upon.
Yeah, we're trying our best to inculcate such values in our curriculum as well, and to form a broader sense that this part of society exists, and we have to coexist with people who are beautiful in their own ways, I must say. But yes, awareness to a large extent still lacks, although I'm quite familiar there are a few centers who are functional and operational in Lahore. And but I still feel that if we have a child from a background where they are enrolled in the mainstream education, they are still sadly and unfortunately labeled by other students and by other parental body. So yeah, I think it'll take probably
more
5
time,
to 10 years for us to completely accept and be okay with the idea.
Right. So I think the focus then goes back to the society at large, that the societal attitudes are something that we need to work upon. Moving towards you, Yameen, I think here we must talk about how education, how media, more particularly social media, that has impacted the society at large, because you see, this is a very important external influence, not only on us as human beings, but also on our human relationships, the way we perceive families, the way we perhaps perceive different relationships, even marriage for that matter, because we have seen surge in the divorce cases over a period of time. So when we talk about social media, when we talk about media or education impacting our human relationships in ways more than one, how would you explain that?
Firstly, I would say that, it has indeed given us a lot of exposure, but there are both the good and the bad sides. So on the exposure point of view, in terms of the positive exposure, I think there has been a lot of development. For example, you see the Me Too movement that initiated from South Korea talked about women rights, women who were being subjected to violence and discrimination in South Korea, and it went global. So it sort of became a talk about women all
Even
around
in
the globe.
Pakistan, it was something which was there for quite some time.
And it sort of advocated the rights of a part of a society that was not being spoken of for a long period of time.
That's right.
And then you see the Black Lives Movement that raised the matter of racism in the US, a country like US that no one knew existed, but it was through the social media that people got to know that, okay, like I sitting in a country like Pakistan know that there are structural and institutional racism that is prevalent in a country like US. So I think it has given a lot of voice to the vulnerable communities, and that sort of online activism then we see converting into actual concrete practices, because we see the people in South Korea being prisoned or being charged with the allegations of conducting crimes against women, and then we see people who committed the racist acts against the blacks in the US being sentenced to jail.
That's
so
right.
I think it's a lot of positive exposure, but then I think it also brings with it a lot of cons, like bullying, like
cyber harassment,
like
data
and all
privacy
of that.
concerns. But you see, I agree with what all you say. But what about the fact media, on the other hand, has also had an impact in eroding our real life relationships? Now, people, if they were sitting together, they would prefer using their phones, using the Wi-Fi, rather than having real life conversations. And I think this is something which social media is time and again accused of, that at some level or the other, it has ended up making us more antisocial. So in that regard, with that perspective in mind, do you not feel then that over a period of time, media has also adversely impacted us as humans too?
I would rather say that it has sort of weakened our value systems, sort of weakened our bonds with the families. So I don't think it's that big of a deal, because if we try to revive it in a way that by communicating, by using social media as a platform to sort of connect with the people around the family that are living in other part of the globe, I think it's better to see the glass half full than half empty.
Right, you mean, on which I'll come to you, Doc Sab. I think here we must also talk about the role of media in that way, and how particularly can it be used in turn so as to ease the burden of healthcare professionals like yourself. So in this regard, how do you feel can media do just that?
Yeah, so media is a double-edged sword these days, because there is social media, and there is a lot of misinformation about health as well. For example, in COVID, we saw that there were some videos circulating, and they became viral. That there was some man who was telling others to take steam directly from the pressure cooker, and there were people who were actually doing that and coming with burns and injuries like that. So this is a misuse of media, and what the government can do, and even the media channels and other people, they can do is that they can regulate it to some extent, that such circulation of such misinformation should be discouraged, it should be stopped.
That's very rightly put by yourself, sir, because when we do talk about self-regulation, that is something very important, because inevitably when you are using the internet, you are bound to come across all sorts of information, and this is something on which you'll agree with me too, because when it comes to education too, we understand the fact that a lot of people now, they get all the relevant information, they actually educate themselves using the internet, using the social media. So in cases like these, when you have very strong chance of coming across all sorts of information, who then do you feel would be responsible of making sure that only the right information is something which the child, which the young person or the possible student then processes?
Well, such emerged concern, especially in the era of COVID, where everybody was using online and digital platforms, and that's where child protection and safeguarding became a primary concern for educators and parents alike. Especially when there's just so much to explore online. It's important on part of the educators to establish a boundary, familiarize them with what sort of a content is available, and also limit the access digitally. That's part of the state, but also to familiarize and limit the access of students to such content, especially in the school setting, and then parents back home, they can try to monitor if the mobile phone or if the laptop or the internet is being used, for what purpose is it being used, and because you see, everything comes at the right time.
Right.
So I feel families and educators, the educational sector, stand in equal involvement on this issue.
Right, Ms. Amna, on which I'll come to you, Ms. Yameen. Here we must also talk about the various stratas of the Pakistani society, which not only includes women, but also minorities, the trans community, differently abled persons, young people like yourself too. So when it comes to their inclusion, when it comes to their true representation, when it comes to empowering them, how do you see them evolving over a period of time? Because we have seen different strata of the Pakistani society, they have made their benchmark, they have made their presence felt in ways more than one in our society, more particularly in the past few decades.
Fatma, the evolution and the development in terms of the rights of the vulnerable communities and their voice in the mainstream policy making processes has been commendable since the past few decades, and I think the future seems quite optimistic as well. However, I think that there are certain loopholes that needs to be addressed in regards to ensure that this progress is in every way very positive for Pakistan. For example, we have a bunch of laws that address the rights of the minorities, those of the trans communities, those of the people with disabilities, those to the downtrodden strata of the society, that for example, the poor people, the lower middle class. So there are a lot of laws, but the issue arises when you see that despite having such comprehensive laws, we lag in the implementation sector.
Exactly.
So
and for that, I think the society needs to take a lead here, because you see a lot of implementation has to do with societal attitudes, the way people are perceived in the society at large. If people don't accept the legitimacy of any law, if they don't want to comply with that particular law, then it's regardless. You can have Pakistan, as we speak, is an overly legislated country. The problem, like you very rightly so mentioned, is that of implementation. So it goes back to the society. How do you, as a young activist, propose can we then work towards implementation of laws, more particularly when it comes from a lack of compliance on part of the society?
The best thing is to start at the grassroots level, and I think in that domain, the role of the civil society organizations is crucial. like you see in the case of COVID-19 in Europe, those countries were able to overcome COVID-19 in such a at such a rapid pace because they involved the CSOs in the policy making procedures, etc. So I think you should involve these grassroots organizations that are working for the welfare of these several communities, let's say trans people, let's say people with disabilities, etc., and also the CSOs. And then I think it sort of will ensure the enlightenment of the people,
Right.
sort of enlighten them about their responsibilities towards the country as well.
Right, Ms. Yamin, your point is noted, on which I'll come to you, sir. Hey, we must also address this very pressing challenge, which time and again repeatedly does come up. The fact we do see that at one end, even if people are allowed access to the healthcare system, they often complain that the quality of service provision is something that is unfortunately not very satisfactory. So when it comes to the quality of service provision and of improving it too, how do you propose can that be done?
Yeah, so this is a very recent and emerging challenge that we are facing. We are not facing the shortage of health facilities, but rather a misuse of health facilities, or I would rather say a burden on some of the health facilities and underutilization of the others. For example, every person here wants to go directly to a tertiary hospital, for example, Mayo Hospital in Lahore or Jinnah in Karachi. So everyone turns up there, and there is a lot of workload on those doctors. So there is a doctor who is looking after 100 patients in the OPD per day. On the other hand, there are hospitals like there is Mia Munshi Hospital in Lahore, where the OPD would be less than 10 per doctor. So we need to build a trust of the people on those hospitals as well, that the quality of service is the same over there. So we do not need to rush to the bigger hospitals for every even for minor ailments like for simple fever or flu or things like that. So the problem is that the people always try to rush to the bigger hospitals, so there is more rush, and hence the quality of service also suffers. And on the other
So how do you then propose can we cater to this problem? Would you then propose there needs to be a shift from the major hospitals to the mid-level hospitals, because that is the only way, logistically speaking, I believe, like you very rightly so mentioned, that when there's too much burden on one particular hospital, on the doctors of that particular hospital, then they can't, possibly be expected to look after everybody with the optimum level of care.
Yes, definitely. So in this, the government can do some regulations like limiting the visits of tertiary care hospital without referral. So unless you have been seen by a general practitioner at a primary care level or at least a secondary care level, you should not be able to access the tertiary care facilities directly. So this is something which is easy to say, but it is very difficult to do because the mindset of the people has to be
It's
changed.
easier said than done.
Yeah.
So that's very rightly put by yourself, sir, because I'm glad that you've raised this, because only if we do address it to be a matter of concern, by that virtue, strive to actually cater it to. On which I'll come to you, Ms. Amna, and before we conclude today's show, I think it's very important then, racking up today's show, to talk about the way forward. Now, we do understand the fact that Pakistan's education system is faced with not one, rather several challenges. But when it comes to overcoming all these challenges, what do you propose is the way forward?
So Fatma, there's a saying that goes, do not try to limit a child to your own learning, for he was born in a different time. And as we have earlier talked about how education is the fundamental cornerstone for economic, political, social and structural development of any country. Currently, the literacy rate of Pakistan stands at 62.3%. And we are, as per last year's statistics, we have allocated 1.7% of GDP to the educational sector. The required minimum GDP is 4% as outlined by UN agencies. So if you want to start off, we might want to have a look at allocating and budgeting significant amount to the educational sector.
Right.
And also trying to look into various aspects, for instance, high quality teacher, getting them enrolled in various professional development courses, giving them more money for their job.
So as to motivate them.
For sure, yes. And having a look at the curriculum, and then also trying to look at proper allocation of resources in schools and books altogether.
Right.
And the way forward is for sure technology. Chat GPT and AI is going to be the new face of Pakistan. But for then we have to let go of our fossilized practices, and then we have to be open to the idea of learning, because this is in this competitive world and meeting 21st century skills, we need to open ourselves if we want to compete at a global
Right, Miss Amna, on which I'll come to you, Yameen. And before we conclude today's show, in this regard, it's very important to have your narrative too. So, when we do talk about young people giving back to the society, something on which we very comprehensively spoke about, what do you feel is something that we need to work upon more? Because, of course, we can't ignore the fact that young people have been giving back to the society. But so as to make this contribution more impactful, do you feel we need better policies in this regard? Do you feel we need to, by that virtue, also strengthen institutions? Or do you feel that by that yardstick, we also need to change the society's perceptions when it comes to young people?
So, Fatma, considering all the advancements that have been brought about by the youth activism in the past few years, it is clear that our youth has a lot of potential. But to strengthen those activities and to bring about fruitful results, I think four areas need to be improved. Firstly,
Right.
we need to focus on our nationalism. We need to develop that sense of nationalism amongst our youth so that they have a very sentimental connection with the country so that they could work for its betterment. Secondarily, we need to focus on our education. We have the highest number of out of school children after Nigeria. So
Right.
we need to focus on providing at least primary level education to our out of school children. Thirdly, I would focus on the need of utilizing science and technology, because Arnold Francis, a Nobel laureate, has rightly said that science and technology will be the most important tool to solving a lot of social problems.
Right.
So I think we should use AIT,
And AI is being used, by the way,
Yes.
in countries like America to actually address so many social issues, be it that of homelessness, of
Yes.
substance abuse.
Exactly. And then I would emphasize on the need of our law implementation sector, so that
I think that is something that we need to, I personally, we need to focus upon the most.
And then there could be a very comprehensive response to the social problems which could bring about prosperity to the country.
Right, you mean your point is noted. On which, sir, I'll come to you. And before we conclude today's show, it's equally important to have your narrative too. So, when it comes to the responsibility and role of healthcare professionals like yourself, what do you feel can people like yourself do when it comes to working for the betterment of the society, when it comes to ensuring people have access to the healthcare system, or for that matter, doctors like you are more affordable for them as well?
So overall, when we talk about the health sector, I think we have a good system in place. We have a sufficient number of resources as well. There is always a gap of resources, but the problem here is the misappropriation of resources. For example,
Right.
All the healthcare services are more centered towards bigger cities. Rural areas are neglected. The doctors and even the nurses and other paramedical staff, they also prefer to work in bigger hospitals, in bigger healthcare facilities, and they tend to avoid going to other areas. So this is a big challenge which needs to be addressed. And another thing which has to be done is translation of our policies into actual implementation. So there is a big gap when we talk while making policies. There are very good ideas and they are explained very well as well, but when it comes to implementation, they are not implemented the way they were foreseen or they were planned. So this is one big challenge which definitely needs to be addressed at every level, at the provider level, at the policy level.
Right, sir, your point is noted. On which note I would like to conclude today's show. Thank you so much, Miss Amna. Thank you so much, Miss Yameen. And thank you so much, Doxa, for your precious time today. Well, to conclude today's show, we generally spoke about the ever-evolving social developments which have happened in the Pakistani society, more particularly since Pakistan became an independent nation. In this regard, we spoke about the various areas which, of course, are of concern, be it the education sector, be it, for that matter, the healthcare system, be it the rights of women, be it the rights of children, even for that matter, youth development. It goes without saying that, we do have the requisite laws and policies in place. What we do need to, of course, actively work upon is their effective implementation. Media has been a very powerful tool with regards to making people aware, but we as a nation also need to learn to self-regulate ourselves so as to ensure that we, use it in an intelligent manner and, of course, in a constructive manner too. On that note, signing off for today. Until next time, take care and Allah Hafiz.